Joining us now is a very familiar face, GP Dr. Helen Wall. You're a menopause champion on social media. You do loads of posts about it and you get lots of reaction with women. What do you make of the dedicated clinic in Zoe's piece?
It's great, isn't it? I think anything that can help women in perimenopause and menopause feel supported, get the help they need is absolutely fantastic in my eyes. You know, there's 13 million women in the UK struggling with perimenopause or going through perimenopause and menopause. I think the difficulty is that we keep hearing from the government, you know, it's in the Women's Health Strategy in 2022, it's now been put on the NHS health checks for GPs to do. The difficulty is, where's the action behind that? Because actually, you know, we just keep adding things on to general practice, but it's a really complex area, menopause, if it's done properly. You know, it is really specialist, and we need to acknowledge that and make sure we've got the services for these women to access.
Complex and then some, because as we heard in Zoe's report, as people watching will know from loved ones, friends themselves, there are so many symptoms.
Yes.
Lots of people don't actually realise they're going through it, and there's this misconception that it's just women in their 40s and 50s.
Yeah, and it's no coincidence, in my opinion, that the highest female suicide rate is in the age group 45 to 54 years in this country. You know, it's really, really important that we don't forget these women. I think the difficulty is that, you know, I'm a registered specialist in menopause, and I had to take time out of practice. I had to take annual leave. I had to put my own funding into being trained in that. And, you know, I love dealing with women in perimenopause and menopause. It's so rewarding. But the difficulty is I can't do that as a job in GP in 10, 15 minutes. It takes time. If you do it properly, to give a proper assessment and management plan to a lady and to really support that lady through that journey, it takes time. And GPs don't have that time or resource to do that on a day-to-day basis. So I think keep labelling it as a GP's job is really difficult. I think they should have basic understanding. I think we should be able to do the basics of it, absolutely. We certainly should not be dismissing these women or not listening or hearing women. But to put it solely on their shoulders, I think is missing a trick. And I think the other thing that I just wanted to really get across here, you know, I hear a lot from people who say, well, women have always gone through menopause. What's the big deal now? Why are we so bothered? You know, why are we making this hype about it? The fact is that we are in a totally different space now as women than we ever were in days gone by. You know, we are functioning as 50% of society. We're not sitting at home having babies and waiting to die. We are in leadership roles. We are earning money, you know, we're paying the bills, we're putting in 50-50 most of the time, or even more than 50% of you know, day-to-day life. And we're trying to run a home, and now we're trying to deal with perimenopause and menopause. And the effects of that on women's symptoms, not just physical symptoms, but mental health, is huge.
And so obviously the clinic in Zoe's piece, essentially that wouldn't work, you don't think, because GPs like yourself just don't have the time or the resources or the money?
It clearly works for them, and I think it's a great model, and I'm not taking anything away from that. I think to try and replicate that at every single practice is going to take resource, workforce and funding, and we're not seeing that yet from the government. We're seeing lots of words in strategies and in NHS health check tick boxes, but we're not seeing that commitment to putting funding where it needs to be to make sure that menopause specialists like myself can do my day-to-day GP job, but then go off and do a menopause clinic for NHS patients. Most of the specialist menopause clinics in this country are private because they're just not funded.
So if we can't do that at every single GP surgery, what's your advice to people sat watching this tonight going, I need help, I need advice, I need to know what to do about this?
Yeah, well, I think there's lots of great resources, support resources out there online. I know that doesn't go anywhere near what people need. They need management, they need treatment. I think the best thing to do is try and speak to your GP practice and ask if there's a GP in that practice that does have a special interest, because although time will be short, at least they're hitting the ground running with that knowledge. And I think going in there armed with information, researching yourself, going in, if you have to, write it down, a list of your symptoms, where you're at, what you think's going on, and fight for yourself. And I know we shouldn't have to say that in 2025 to women, but women have to fight for themselves.
Really great advice, Dr. Helen Wall. Thank you so much for your time.
Thank you.
Well, let's take a look at some more of the day's news now. And a coroner's issued a warning about home births after the death of a mother and her newborn daughter.